This month on the Taboo Topics podcast.
Some women just don't feel like a woman anymore if they don't have a uterus, when that actually has not a lot to do with being a woman. It's everything up in the brain that has more to do with being a woman, and sexual satisfaction mostly comes from the clitoris and supratentorial, the brain, how you feel. Very, very, very little has to do with your actual uterus or vagina.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast@orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, and welcome to Taboo Topics, where we address embarrassing personal health questions to take some of the stigma out of those discussions. I'm your host, Mary Frances Emmons, and today's topic is sex during and after cancer treatments. My guest is Dr. Shelly Seward. She is a gynecologic oncologist with the Orlando Health Cancer Institute. Welcome to Taboo Topics, Dr. Seward.
Thank you so much for having me here to talk about a subject that I hold near and dear to my heart, but not a lot of people discuss.
So first, tell us how this fits into your work at Orlando Health and why it's important to talk about this.
As a gynecologic oncologist, I take care of women who have ovarian, uterine, cervical, and vulvar or vaginal cancers. So we do advanced surgery, we do chemotherapy, we help coordinate radiation therapy to all of these areas to help you get cured from the cancer. But after your cancer, we still want you to live. That's the whole purpose of going through all of that, is to live. So by all means, go out and live. Relationships are important for intimacy, both emotional and physical. So that is an important part of living. If it is to you, we can help you. Don't be afraid to ask, because there are lots of things out there now, especially even those women who can't have hormone replacement therapy, where we can make it better. So just ask. And if you don't feel comfortable with your provider, give me a call, because I'll feel comfortable talking about it.
So what are your cancer patients most concerned about regarding intimacy? Like, what are the hardest things for them to speak about, either to you or to their partners?
So it's kind of like a trifold thing. When we talk about intimacy issues, one is emotional. How do you feel now? There are some women who feel if their ovaries and uterus removed, they're no longer a woman because they don't have their woman parts. And that's not true. So there's an emotional component to it like that. You can also have a physical component. If your ovaries have been removed or no longer functioning because of chemo or radiation or even just age, your hormones are different. Your hormones are responsible for doing things down in that area, as well as kind of supratentorially and feeding back loops for stimulation, et cetera, et cetera. We talk about all the hormone effects for puberty, but we don't talk about the hormone effects as we age or the ovaries are no longer working because of what we did. One of the other things that we want to talk about are actual physical limitations. Sometimes I do surgeries where part of the vagina is removed. Sometimes we do surgeries that cause scarring to the vulva or the vagina or even removing of the clitoris. Sometimes we do surgeries that leave you with an ostomy bag or something like that that can physically impede your intimacy. But there are lots of things we can do to get around that and educate and things like that. So it's really important to talk to a knowledgeable provider. I also love it when the partner comes in, because I think it's important for me, an educated expert in this field, to say to that partner, listen, this is real. She's not crazy. These are real changes that really need to be addressed. Also, some of it she can't help. I did some of that to her by causing some hormone changes or some anatomic changes, but there's ways to overcome it. Sometimes a partner will not feel comfortable talking with their partner about it. Let me do it. I've done it for years.
I was going to ask about special challenges for partners because I imagine sometimes the right thing before cancer treatment is not the same afterward. How can they know? Are there resources for partners, or maybe they can talk to you also?
I love when they come in and talk to me, and I kind of have a little spiel that I do. What I explain, and I love it when the man and the woman are in the room together or two female partners. When I talk about intercourse, when we talk about men are pretty simple. They're like a light switch. They go on and off. They're pretty easy. Women are more like the cockpit of an airplane. All of our buttons and levers have to be in the same position in order to get takeoff, right? We need to feel loved. We need to feel safe. We need to not be running the list. We don't need to worry about what he's going to think of us now that I have this bag or that my vagina has a scar on it, right? So all of those things have to happen and they all have to be addressed. And they need to be addressed with both the patient that I take care of and the significant other so they can work together because this is a together activity. It's not a solo mission. However, women forget that intimacy also can be a solo mission. Even if you don't have a partner, it may still be important to talk about, can I self-pleasure myself? Can I do that again? How am I going to do that? What changes do I need to make? But those are important questions as well. And sometimes we forget to address that with women if they don't have a partner.
More on this after the break.
This episode is brought to you by the healthcare leaders at Orlando Health, where we deliver the future of medicine today. Orlando Health. Choose well.
Do concerns about sex vary with the type of cancer? Like, is it different with different cancer treatments, different types of chemo, or not necessarily?
Absolutely. There are certain cervical cancers that happen in 30-year-old women. And when we give them radiation because they're not a candidate for surgery because the cervical cancer spread, we kill those ovaries with radiation. Those ovaries are very, very sensitive. Those gals can have hormone replacement therapy and help with some of that hormonal changes. Whereas that scar tissue that they have in the vagina, we got to overcome that with other ways. Orlando Health has a wonderful pelvic rehab program that can do a lot of good things for them. We can put local hormones there to kind of help with that elasticity again. And that's different than an older woman who might have had vulvar cancer where I cut part of that off. We may have to do pelvic rehab or even at-home stretching exercises with a little lubrication to help get that back to normal. Your pelvic floor is a muscle. You don't use it, you lose it. But it's a muscle. So with enough rehab and therapy, we can make that all work again better than maybe even before. And if we do have changes where we can't replace hormones, such as women with estrogen receptor positive breast cancer or estrogen receptor positive GYN cancer, there are lots of things out on the market now that are not hormone related therapies, but are supplements that can help with hot flashes. They can help with lubrication. They can actually help with drive for intercourse. So there's lots of things to be had. And yes, it is different for everybody, but it involves all those same factors. Emotionally, physically, how are we going to repair it or make things a little different?
So, is there ever a time during treatment when sex is not a good idea for any reason? And I also wondered if does chemo or other treatments for cancer affect the possibility of pregnancy? Do you need to change your approach to birth control?
Absolutely. So first things first, anytime you have a hysterectomy, when your uterus is removed and we're trying to heal that upper vaginal incision from where we took it off, you should not have intercourse for at least 6 full weeks after that, allowing that to heal. Unfortunately, on occasion, somebody tries to have intercourse too soon and pops open the vagina and we got to go back to the OR. So there are those physical changes. If I've had to do surgery on the vulva or the vagina, I don't want things rubbing against that area until it heals, another 6 to 8 weeks. But hormone replacement therapy is important too, and that depends on age and it depends on what kind of cancer you have. Birth control, absolutely. So if you're a young gal and you're on breast cancer chemotherapy, you will need to be on some therapy to prevent you from getting pregnant because we don't want you to get pregnant on chemo, but there are certain chemos where you absolutely could get pregnant while on chemo. So yes, it's different depending on what kind of cancer you have, where we did surgery, radiation, can you or can you not have hormones, and are you able to still have a baby but shouldn't? We need to address all those issues. There are other issues as far as how we do birth control for them as well. Cancer can increase your risk of blood clots. Certain oral contraceptions can, but there's local things we can do that decrease your risk of blood clots, but are still going to prevent an unwanted pregnancy during cancer care.
So, how about after treatments conclude? You mentioned sometimes people feel differently about themselves and that can affect intimacy also. Are there other barriers, after the treatment is concluded to intimacy, either physical or emotional?
I think once you heal and we can kind of take care of some hormones if we can, or some lubrication if we can, a lot of it's emotional. And that's important to know because some women just don't feel like a woman anymore if they don't have a uterus, when that actually has not a lot to do with being a woman. It's everything up in the brain that has more to do with being a woman, and sexual satisfaction mostly comes from the clitoris and supratentorial, the brain, how you feel. Very, very, very little has to do with your actual uterus or vagina.
So this is great to know. Is there anything else you would want listeners to know about this question?
I don't want it to be on your taboo topics list anymore. I don't want this to be a taboo topic. It is important. And cancer is important, but living your life after your cancer is also important. So make sure you address those so you are living your life the fullest. If you don't want to, that's fine. I bring it up with all my women, whether they want to talk about it or not, because I give them the option. You want to go there? We're going there. If you're comfortable where you were before cancer treatment and afterwards, that's okay. There have been women where my cancer treatment didn't really affect their ability to have intercourse. That was affected prior. And when I bring it up, they're like, wait, I didn't think I could change that 10 years ago. Yes, we can. Let's work on it together. And they're actually pleased. So yeah, there's a lot that goes into it. But again, I don't want it to be taboo anymore. Feel free to talk about it.
Yay, great. We're going to check this one off the list. Thank you so much, Dr. Seward, for being our guest today on Taboo Topics. Listeners can learn more about Dr. Seward and her work at orlandohealth.com.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.